Emergency contraceptive pills, often called morning after pills, are a form of birth control used after sexual intercourse to prevent pregnancy. Unlike regular contraceptive methods such as birth control pills, intrauterine devices, or condoms, ECPs are designed for occasional use and should not replace regular contraception. They are particularly useful in case of unprotected sex, contraceptive failure such as a broken condom, or situations like sexual assault. There are two main types of emergency contraceptive pills. The first type contains levonorgestrel, a synthetic hormone that is similar to progesterone. This type is available over the counter in many countries and is most effective when taken within 72 hours of unprotected intercourse. The second type contains allopurinol acetate, which works differently by inhibiting ovulation and is effective for up to 120 hours, that is 5 days after intercourse. Some doctors also prescribe higher doses of regular birth control pills as emergency contraception, but this method is less common due to potential side effects. So how do emergency contraceptive pills work? The primary function of emergency contraceptive pills is to prevent pregnancy before it occurs. They work through several mechanisms depending on the timing of administration and the phase of the menstrual cycle. The most common mechanism is delaying or preventing ovulation, ensuring that no egg is released for fertilization. If ovulation has already taken place, emergency contraceptive pills may also affect sperm movement, making it harder for fertilization to occur. Contrary to common misconceptions, emergency contraceptive pills do not induce abortion. They do not affect an already implanted embryo or disrupt an existing pregnancy. Instead, they prevent pregnancy from starting by inhibiting fertilization or implantation. This distinction is important in ethical and legal discussions regarding emergency contraception. Emergency contraceptive pills are highly effective when taken promptly. Levonorgestrel-based pills can reduce the risk of pregnancy by 75 to 89% if taken within 72 hours, while allopurinol acetate is even more effective, reducing the risk by approximately 85% when used within 5 days. However, their effectiveness decreases the longer the delay in taking them after unprotected intercourse. Several factors can influence the effectiveness of emergency contraceptive pills. For instance, women with higher body weight or body mass index may experience reduced effectiveness, particularly with levonorgestrel-based pills. Additionally, certain medications, including some anti-epileptic drugs and herbal supplements like St. John's wort, may interfere with the pill's efficacy. It is also essential to understand that emergency contraceptive pills do not protect against sexually transmitted infections. They are solely meant for pregnancy prevention and should not be used as a substitute for barrier methods like condoms, which offer protection against STDs and STIs. Side effects and safety of emergency contraceptive pills. Emergency contraceptive pills are generally safe for most women, but they can cause temporary side effects. Common side effects include nausea, fatigue, headache, dizziness, breast tenderness, and irregular bleeding. Some women may experience changes in their menstrual cycle, such as an earlier or later period than expected. These side effects usually resolve on their own without medical intervention. In rare cases, severe allergic reactions or prolonged bleeding may occur, requiring medical attention. However, emergency contraceptive pills do not have long-term health risks and do not affect future fertility. Women who use emergency contraception can conceive normally in subsequent cycles if they wish to become pregnant. Repeated use of emergency contraceptive pills is not harmful but is not recommended as a regular contraceptive method due to lower effectiveness compared to routine birth control options. Women who frequently require emergency contraception should consider discussing long-term contraceptive solutions with a healthcare provider. The availability and use of emergency contraceptive pills have sparked ethical, cultural, and religious debates worldwide. Some individuals and organizations oppose their use, equating them with abortion despite scientific evidence proving otherwise. Others argue that increasing access to emergency contraceptive pills empowers women to take control of their reproductive health, reducing unwanted pregnancies and unsafe abortions. In some countries, emergency contraception is easily accessible over the counter, while in others, strict regulations require a prescription or prohibit its use entirely. The disparity in availability highlights the ongoing challenges in reproductive rights and healthcare policies. Additionally, there is concern that easy access to emergency contraceptive pills might encourage irresponsible sexual behavior. However, studies have shown that access to emergency contraception does not increase risky sexual activity but rather provides a crucial safety net for women in need. Educating individuals about responsible sexual behavior, contraception options, and reproductive health remains key to addressing such concerns. Despite the proven effectiveness of emergency contraceptive pills, many women remain unaware of their availability or proper uses. Misinformation and societal stigma often prevent individuals from seeking or using these when needed. Comprehensive sexual education programs play a vital role in spreading awareness about emergency contraception. Healthcare providers also have a significant role in educating patients about emergency contraception. Pharmacists, doctors, and reproductive health organizations should ensure that accurate information is accessible and that women feel comfortable discussing contraception options. Addressing misconceptions and fears associated with emergency contraceptive pills can help more individuals make informed choices regarding their reproductive health. So friends, emergency contraceptive pills are a crucial advancement in reproductive health care, offering women a safe and effective option to prevent unintended pregnancies. While not a substitute for regular contraception, they serve as an essential backup method in emergencies. Understanding how emergency contraceptive pills work, their effectiveness, potential side effects, and ethical considerations can help individuals make informed decisions about their reproductive choices. Take care.